Hi, I'm the virtual Judy Vitucci. I wish I was there with you in person, but I tested positive for COVID a few days ago, and I didn't want to expose all of you. And I'm sure you didn't want me to expose you either. This session is about um, home visiting and about family engagement. And you may have, and family engagement research. You may have noticed a paper on the table in front of you. It's called Hit or Miss. During this half hour, I want you to pick up that hotel pen and answer the true or the questions, whether you think they're true or false, hit or miss. You can also doodle on the front, but you don't want to doodle on the back because you may want to use those affirmations with your clients when you hear about their effects. So here's what you're in for today. There's just one objective. I want you to be able to use home visiting research to improve your home visiting practice or your your site's your coalition's home visiting practices. There's, a lot of wisdom in this room, and I want to acknowledge your home visiting experience and your expertise. I understand how hard it is to connect with every family, for your home visitors to open their minds and their hearts to even the most difficult clients, trying to encourage them to be the very best that they can be for their children. We know that nationally, up to 40% of families who are invited to enroll don't enroll. So those that are eligible, and that one third of those who actually sign up drop out of the home visiting program before they complete it, and that 70% remain enrolled, for 6 months. But a lot of that rests on the home visitor's ability to convince the parent that spending time with them is worth it and continues to be worth it so that they continue to open the doors for them. We're everyone in this room, in that room, is aware of the positive effects of home visiting. This is what you tell parents. This is what you tell legislators, that there's improved child outcomes, prevention and early intervention, and long-term benefits. But last month, an evaluation report, actually, it was just a couple weeks ago that this report was published by the Office of Planning, Research, and Evaluation. And that evaluation found long-term positive effects of home visiting 5 to 7 years after enrolling. So by the time the kiddo reaches kindergarten, they found statistically significant positive effects for these 5 outcomes: improved maternal coping strategies, strengthened parent-child interactions, better maternal, mental, and behavioral health, reduced family conflict and violence, and also improvements in the family's economic circumstances. That's all very positive and something else that you can share with legislators. And they also found some evidence of positive effects of home visiting for 3 other research questions that they have, and those were and these 3 were not statistically significant, but they were positive. And like children's social emotional functioning in the home. Actually, that one was statistically significant and positive. Children's social emotional functioning in school settings was positive, but not statistically significant. And the authors suggested that that's because a very small number of teachers reported on the kids. And children's cognitive, language, and math skills were also positive, but not statistically significant. Now, my focus today is on recent research. Fortunately, I came across this resource, which was again from the Office of Planning, Research, and Evaluation, and it synthesized recent home visiting research, which was wonderful for me. And it answered the questions, what makes a family enroll and what makes them stay? So let me tell you what they found. These are strategies for enrollment. Building relationships with referral partners, and making sure that the information that you disseminate is really clear and up to date. Asking families to tell their friends by, you could even create a refer a friend program, as some of your coalitions probably have done, and the coalitions that have tried it have had success in revising and simplifying the enrollment process. The E down there, supporting a favorable match and a positive dynamic between home visitors and families, is something that is talked about in the literature a lot. And at first, having similar racial or ethnic backgrounds is helpful. However, other factors may be even more important, like similar life experiences or personalities. It's it was kind of surprising to me that um, that empathy didn't show the expected statistical association, and neither did a home visitor's tenure. How long they've been practicing, or how long they've been doing home visiting, their experience or their education. None of those things were significant. Um, they did find that offering flexible scheduling and content that prioritizes the family's needs does increase enrollment, as you might expect. There's a, a lot of family literature, family engagement literature that's coming from behavioral economics. And they found similar kinds of things, that redesigning your outreach materials and approaches was a successful strategy, especially using like personal welcome letters and home visiting introduction cards. um, Reducing tax complexity. Again, you hear it again, especially the enrollment process. They also found that recalling a proud moment increased parents' interest in parenting programs. It affirms their self-worth and disarms their fear of judgment. And that strategy increased interest in home visiting by 6%. That's pretty significant. And it was a little bit less in Black African American families, but and they didn't really report out about Hispanic and other ethnic folks. And then the fourth, automatically enrolling participants in a complementary service. An example of that might be to automatically enroll them in a text messaging service about development, always with the option for them to decline. And here are a few other barriers to enrollment. Parents may not think that they need home visiting, even if they think the program is really good and really valuable. They might not want it. When school or work schedules overlap with the home visiting hours, or if you're expecting too many home visits, it may make it hard for families to participate. And there's some reasons that families gave for not enrolling included previous negative experiences with healthcare, stigmatization, and of course, distrust of a home visitor in their home. And especially more recently, fear of immigration repercussions is certainly a barrier for that some families face. Other barriers to enrollment are housing instability. If they're homeless, or their housing is unstable, it may cause loss of home visitor contact with them. And if they don't know about the benefits of home visiting, or if there's too much paperwork, it can be a barrier. Some programs like Nurse Family Partnership, now that's not us, but have a very limited enrollment period. And fortunately, that's not a problem with Healthy Start. Moms referred in an overwhelming period are less likely to remember that the program was even offered to them. Moms Often mom's energy and mood may fluctuate right after birth. So she may say yes one day and then decide, no, that's too much for me now. And interestingly enough, Alachua in their McPhee program found that moms with babies less than 3 months old are very hard to contact. And I wondered if you're finding the same thing. You might want to ask your home visitors. And so this research also tells us what facilitates retention. I'm so impressed with the newest Healthy Start model. It's excellent content. I'm really proud of you for putting that together. And as you all know, families enroll and stay in home visiting if they think it's beneficial. Some families are especially interested in programs if they include community referrals. Doula service is certainly hot now, isn't it? And or mental health, and they may need those referrals right away. There's a lot of studies reference a match between the home visitor and the family, and you know uh, families describe valuing home visitors who were flexible, friendly, reliable, non-judgmental, respectful, and supportive, kind of like a saint. And the third one there about flexibility. Family engagement is more likely if families have time or the flexibility to accommodate appointments. But then again, their schedules may fluctuate over time, and they may not be able to participate. Lower staff turnover typically promotes retention, and the opposite is also true. So if you have high turnover, you probably will be losing clients as well. And some families found that parents of younger children at enrollment tend to have higher retention. So once you get them early, it may help retention. Some of the barriers to retention are that we know that families' experiences with home visiting are shaped by their sense of connection to their home visitor. I bet every home visitor has seen the signs of disengagement. I think like missing appointments, reluctance to be open with the home visitor, ghosting the home visitor, or just it feels like a poor fit. If the family thinks that the home visitor is forceful or pushy, it can create a negative dynamic. Um, and 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 you'll see it in retention. Unmet, if the family expects something and then they don't get it from the program. So unmet program expectations or messages, home visiting, home visitor messages that conflict with the family's culture or values may also be a barrier. Racism, discrimination are also barriers. And if the family moves out of the service area or their schedule changes, those are cited as consistent barriers to retention in the literature. Unenrolling families when they miss they unenrolling enrolled families when they miss it also can cause obviously is a barrier to retention if you let them go, or conducting less outreach to families because your staff is too busy or something is a barrier. And number 6 is higher rates of housing mobility is commonly associated with lower retention. And in Florida, because of the high cost of living and sometimes transportation issues, that those are also barriers. Here were some tips in the literature of how to reach hard to reach families. And they suggested making events fun with time to socialize with other families. And, by golly, you know how to do this. Your holiday parties, your community baby showers, your, graduations. Um, you break you might have a Hispanic luncheon. You break bread with the families, you build trust, and what a concept. The second one there is using strategies that meet the parents' basic needs. And I know you do this too. Distributing hurricane supply kits, diapers, food, all those things are found to promote retention. And two-way communication is very important. Your client satisfaction surveys, ask for feedback. If you're developing a new form or a new process, ask for feedback on how it's going, and ask for comments. And some programs are asking the families, 3 months into the home visiting, their home visiting enrollment process, how are we doing? Am I helping you meet the goals that we established at the beginning? I wanted to tell you just a little bit about precision home visiting. And when I first heard that term of precision home visiting, I bristled. I envisioned little robots delivering educational content, and I thought, oh, yuck. But I changed my mind after hearing about the work of these researchers. They're HRSA funded and university based in a couple different sites, and they're all working together to try to identify what works best and under what conditions. So they are seeking home visiting sites to try out some of their ideas. So they would develop the concepts, and they would ask for you to collect a bit of data and see if whatever it is worked. And you're using rapid cycle testing to evaluate and improve. So it's small tests of change that they would be testing, not year-long research. So while a rich body of research, we have a rich body of research over the last 20 years, and it shows home visiting's impact. Those studies reveal similar effect sizes for the evidence-based home visiting models, and they only looked at evidence-based. So it did not include healthy start, but it include the evidence-based ones. But I would put the new healthy start model up against any of those other evidence-based home visiting models. They found that the average effect size were modest. And modesty is a virtue, but not when you're evaluating home visiting programs. And they found that all of those programs had very similar effect sizes. So the bottom line is we need more research to identify what works best for whom to improve home visiting outcomes across diverse families. And look at this. We know that moms enroll in home visiting for many reasons, and those reasons are on this left side. I don't know whether you can see my arrow, but I'm pointing to the left side of this screen. And so, you see that most of them are enrolling for parenting, education. And then I want you to come over to the right-hand side, and the right-hand side compares the mother's reason for enrolling with the mom's satisfaction with that component on the right-hand side. So what we see is that most were satisfied, 79% were satisfied with the parenting education that they received, but only about half were not satisfied. Only about half were or about half were not satisfied with efforts to address their other reasons for enrolling. Here are some tips from, let me start that over just a bit. We know that the same approach doesn't work for all families. There was one study found that home visiting programs improved behavioral outcomes in families where the mother was either depressed or anxious, but not both. Um, these researchers found that home visiting is highly effective for moms who are just anxious. And there is also strong evidence that improved patient-child interaction is linked to many, many long-term outcomes. And researchers also found that motivational interviewing had substantial immediate effects. Did you get that? Immediate effects? But that effectiveness um, after after 2 months or 2 months after the training was completed did decrease. We know that videotaping can be a very useful for both the home visitor and the families, especially if it's done with feedback and coaching. So one size doesn't fit all, and we need to know more. So here are some of the other topics that need further research. Families' reasons for enrollment. All we know now is that they enroll for their baby and stay because it's helpful to them. So we need to know more about how home visiting programs can be tailored, flexible, and flexible. Um, and all the literature talks about matching the home visitor and families and how important that is, but they don't tell you how to do that. We need more strategies for community partnership. And I found no research about how to facilitate re-engagement of families when they miss appointments. If it We don't know. If you allow breaks in service while the family is enrolled, does the family return and engage again? We don't know. So let's see how you did on that little quiz in front of you. Number 1 and 2 are both true. Research tells us if the family thinks that the home visiting program is going to benefit them, they will enroll. And many, many, many studies confirm that. Um, new parents enroll for their baby but remain in the program to help themselves. That is also true, or a hit. Number 3, oh, where'd my tea go? It went upstairs. The best time to enroll to recruit a family for home visiting was right after birth, and that is a myth. Researchers say this is a myth, but the timing of the referral does matter. As you see here, mothers who were referred, and I already told you this, during an overwhelming times, such as immediately following birth, are less likely to remember. And number 4, a positive, trusting, and supporting dynamic between families and home visitors promotes retention. That is true. And I already shared that research earlier. Number 5 is, I have to get myself situated, is high home visitor turnover has no effect on retention, and that is a myth. It does. And 3 studies reviewed found that staff turnover is a barrier to retention. Although there's one study that that said it wasn't statistically significant. And this one is true. A negative home visitor family dynamic is a barrier to retention. And I think I already shared that research too about, yes, I did. Number 7, a successful recruitment tool is to use pride-based self-affirmations, and that is true. So again, I already shared that research. Incentives are a good recruitment and retention This one had mixed results in the literature, providing families or kids with or babies with ancillary incentives, toys or books, does support enrollment in the parenting training programs, according to one review, but offering financial incentives did not influence enrollment. We'll count that as both true and false. The next one is 9. Um, this one is true, a hit. All these strategies were successful. So, incorporating reminders, providing written guidance, encouraging participants to make plans, and emphasizing deadlines, using personalized greetings, and reminding participants to re-engage in program activities to maintain eligibility. Number 10, including fathers in home visits improves family retention. We're going to count both of those. There were 2 studies that found that fathers' participation did not consistently influence the mother's retention, but research is fickle. A Texas study showed that families whose father participated in at least one home visitor were enrolled 7 months longer than families with no father participation. And 11 is a myth. None of these things were found to relate to retention, not training. This one bummed me out. Staff training and continuous quality improvement, staff recruitment, challenges, program age, organizational culture, caseload size, none. Isn't that, I found that really surprising, but that was several studies. And number 12 is false. I found this counterintuitive. Home visitors who perform well generally know. Nope. They found that the researchers found that home visitors who performed well were often not able to articulate how they do what they do and how they get better outcomes. So that brings us to the end. How can you apply these ideas? Just think about what is one small change that you can make by next Wednesday. And I encourage you to start now, start today. Well, maybe not while you're at this meeting, but just start, because home visiting is going to be better because you did. And I'll sign off with that. I wish you a very good meeting, and I'm sorry that I couldn't see you in person. Bye.